Post-menopausal bleeding. Post-menopausal bleeding. First one, the definition of menopause. Menopause is the permanent cessation of normal menstruation due to ovarian failure or ovarian aging, due to the depletion of ovarian follicle. Women have to stop menstruation for 12 months. So the menopause, it is a permanent cessation of normal menstruation for at least 12 months. This is the definition of menopause. The mean age group of menopause is 51, with the normal range between 45 to 56. المين age 51 سنة. الرينج between من 45 لل 56 هذا نعتبره normal age group for menopause. يعني إذا اجتنا women صايرة menopause عمرها 45 سنة هذا يعتبر normal، مو premature ovarian failure، مو premature menopause. زين؟ ف mean age group between 45 to 56. Why menopause occur? Due to the ovarian aging or ovarian failure. So the definition of post-menopausal bleeding, it is bleeding from genital tract occurring at least 1 year following the cessation of spontaneous menstruation. طبعاً after age of 45 years old. So any vaginal bleeding or any bleeding from genital tract after age of 45, at least 1 year following the last spontaneous menstruation, it is represented as post-menopausal bleeding. It is a serious symptom which may indicate the presence of malignant disease in the genital tract. So, because it is a serious symptom, so every woman with post-menopausal bleeding should be assumed to have a carcinoma until full investigation prove otherwise. The causes of post-menopausal bleeding. عندنا local cause. First one هي local causes. عندنا systemic causes. Local causes نبدي بالgenital tract نبدي from the uterus. Uterus either endometrial carcinoma or leiomyosarcoma, endometrial hyperplasia, endometritis or endometrial polyps. هذا regarding to the uterus. Regarding to the cervix, either cervical carcinoma or cervicitis, cervical polyp or cervical trauma. Third part regarding to the vagina, either vaginal carcinoma or senile atrophic vaginitis, vaginal trauma, foreign bodies like psoariasis, vaginal inflammation and vaginal polyps. Vulva, the fourth one, fourth part, like vulval carcinoma or vulval dystrophy or vulval trauma. Other causes related to the local cause, fallopian tube carcinoma or secondary tumors from ovaries, breast, colorectal carcinoma or urethral carcinoma. So the causes of post-menopausal bleeding, first one, local cause. Local cause, نبدي بالgenital tract from the first part, uterus. uterus, either endometrial hyperplasia, endometrial carcinoma, endometrial polyp, or endometritis. Second part, cervix, either cervical trauma, cervical carcinoma, or cervical polyp. Third part, vagina. Vagina, the most common cause is senile atrophic vaginitis, vaginal carcinoma, vaginal foreign bodies, vaginal trauma, or vaginal inflammation. And the fourth part, vulva, like vulval carcinoma or vulval trauma. Other causes like fallopian tube tumor or other tumor from the breast, from the GIT tract, or from the ovaries. Second one, systemic causes. Systemic causes, first one, bleeding disorder. Bleeding disorder or leukemias, pancytopenia, or drugs therapy like anticoagulant. Second one, hormonal replacement therapy. Or third one, estrogen producing tumor. And the fourth one and the last one was peripheral conversion of androstenedione. So, causes of post-menopausal bleeding, either local cause or systemic cause. Local cause related to the genital tract, either uterus, cervix, vagina, vulva, or fallopian tube. Systemic cause related to the other system of the body, either bleeding disorder or hormonal replacement therapy, or tumor-producing estrogen, or peripheral conversion of androstenedione. This is the precursor of testosterone, this conversion to the testosterone, then conversion to the estrogen. The most common etiology or most common causes, first one, atrophic vaginitis. Atrophic vaginitis represented about 60 to 80% of causes of post-menopausal bleeding. Atrophic vaginitis due to the ovarian aging or ovarian depletion of the ovarian follicle, lead to the decreasing of estrogen production, lead to the thinning of endometrium. Second one, estrogen therapy or hormonal replacement therapy, which is represented 15 to 25% of post-menopausal bleeding. هذا التقسيم according to the commonicity. Okay? Endometrial or cervical polyp or endometrial hyperplasia. Endometrial carcinoma represented 10% and cervical carcinoma represented 5% of all post-menopausal bleeding. So the most common cause is due to the atrophic vaginitis. Atrophic vaginitis, but may represented carcinoma or tumor of genital tract. So it is a serious symptom. Atrophic vaginitis. The majority of women with post-menopausal symptoms will be found to have atrophic vaginitis, whereby the vaginal epithelium thin and break down in response to low estrogen level. This is a benign condition which is relatively easily treated by local estrogen. So atrophic vaginitis or atrophic endometrium, atrophic vaginitis and atrophic endometrium represent 60 to 80% of cases of postmenopausal bleeding. Due to the low estrogen production, the epithelium of the vagina and endometrial cavity become thinning and easily to break down. It is a benign condition and easily treated by local estrogen. Estrogen therapy or hormonal replacement therapy. In women with combined cyclical HRT hormonal replacement therapy, bleeding in the progesterone-free period is a normal condition. So, any schedule bleeding refers to the bleeding at other time. This is abnormal and should always be investigated. البيشنت إذا على combined oral cyclical HRT يعني تاخذ استروجين وبروجسترون. So the bleeding in a progesterone free period, it is a normal condition. يعني إذا كملت البروجسترون المفروض يصير withdrawal bleeding. فهذه normal condition. Any schedule bleeding refer to any bleeding at other time rather than progesterone free period. يعني وهي جاي تاخذ بروجسترون وهي جاي تاخذ استروجين. This is abnormal bleeding and should be investigated. Endometrial hyperplasia. It is abnormal proliferation of endometrium. Abnormal proliferation of endometrium, which is represented 5 to 10% of post-menopausal bleeding, occur due to the excessive estrogen stimulation of the endometrial gland. More than 3 to 4 millim in post-menopausal bleeding is significant, and 5 millim endometrial thickness in the patient on hormonal replacement therapy. إذا البيشنت ما تاخذ hormonal replacement therapy, so endometrial thickness 3 to 4 millim by transvaginal ultrasound, it is a significant. المفروض less than 3 to 4 millim. And 5 millim for those on the HRT, more than 5 millim for those on HRT represented suspicious of endometrial hyperplasia. Classification of endometrial hyperplasia. First one, either hyperplasia without atypia. Either simple hyperplasia without atypia or complex hyperplasia without atypia. Treated by progesterone, either oral progesterone or levonorgestrel intrauterine device اللي هي المرنة. The second one, hyperplasia with atypia, which is a pre-malignant lesion, treated by total abdominal hysterectomy because it have a significant risk to conversion to the malignancy. Risk to conversion to the malignancy between 25 to 30%. إذا hyperplasia with atypia, but hyperplasia without atypia risk to conversion to malignancy less than 1%. إذا simple hyperplasia without atypia treated by progesterone. Complex hyperplasia without atypia treated by progesterone. Complex hyperplasia with atypia either by hysterectomy or progesterone. إذا complex. Depending on condition of the patient, depending on aging of the patient. If endometrial carcinoma treated by total abdominal hysterectomy and bilateral salpingo-oophorectomy. The fourth cause of post-menopausal bleeding, endometrial carcinoma. Endometrial carcinoma is the second most common gynecological cancer. It is mainly adenocarcinoma arising from the lining of the uterus, and it is estrogen-dependent tumor. It is represented about 10% of post-menopausal bleeding. 90% of patients with endometrial carcinoma presented with bleeding, either post-menopausal bleeding or perimenopausal bleeding or irregular vaginal bleeding. So 90% of the patients present with vaginal bleeding. Endometrial carcinoma has 4 stages. First one, confined to the uterine bodies, either A or B, less than 50% of the myomaterial involved, B, more than 50% of myomaterial involved. Stage 2, involving the cervix. Stage 3, outside the uterus, but not outside the pelvis. And it's still inside the pelvis. Stage 4, extended to the bladder or rectum. يعني راح يطلع عنا أو extended outside the pelvis. Endometrial carcinoma. Treatment of endometrial carcinoma. طبعا الريسك فاكتور of endometrial carcinoma هي nulliparous women, obese women, early menarche, and late menopause. Tamoxifen therapy, diabetic, hypertension, obese patient, family history. إذا عندها endometrial hyperplasia. All these risk factors for endometrial carcinoma. Diagnosis usually by biopsy, by endometrial biopsy. Treatment of endometrial cancer usually begin with the staging, which involve LASIK surgery. So should begin with staging, which involves total abdominal hysterectomy with washing, bilateral salpingo-oophorectomy, and lymph node evaluation. The need for post-operative adjuvant radiotherapy is determined by recurrence risk. If the patient with disease confined to the endometrium with little or no invasion into the uterine muscle, to the myometrium, usually required only surgery. يعني ما يحتاج adjuvant therapy. When the cancer deeply involved or deeply invade into the myometrium or separate outside the uterus, usually adjuvant therapy, either radiotherapy or chemotherapy, is indicated. Prognosis of endometrial carcinoma usually good because the disease detected earlier by vaginal bleeding. Treatment of endometrial cancer usually surgery, by surgery. Even 3rd stage, usually surgery. By staging, surgery. Total abdominal hysterectomy, bilateral salpingo-oophorectomy, and lymph node washing. يبقى الادجuvant therapy, radiotherapy, chemotherapy depending on stages of disease. Stage 1A usually without adjuvant therapy. Stage 1B and up usually need adjuvant therapy. Diagnosis of post-menopausal bleeding. First one, by history. History, when your last period to confirm the menopause. When the bleeding start, يعني ناخذ الهيستوري على bleeding, ناخذ any precipitating factor, trauma, any foreign body, any drug therapy. History of risk factor for endometrial cancer, diabetic, hypertension, obese patient, late menopause, early menarche, polycystic ovarian syndrome, any associated symptom with vaginal bleeding, with pain, fever, any changes in bladder and bowel habit. All these by history. Any family history or personal history of a bleeding disorder. Medical history or any drug history. any coital relation or any past obstetric history, gynecological history, surgical history, and when was your last pap smear done? If any abnormality like cervical dysplasia or cervical malignancy should be screening. By history. By examination, عندنا general examination and systemic examination. General examination, obese patient, thyroid patient, thyroid إذا عندنا pallor, cyanosis, jaundice, cachexia patient, vital sign, abdominal examination for any abdominal mass, any abdominal tenderness, and then for speculum examination of the cervix and vagina to exclude any atrophic vaginitis or any cervical lesion, cervical polyp, vaginal polyp, cervical ectropion, trauma, or mass. Aim of examination to focus on determine the bleeding site of the bleeding and not any suspicious lesion. By speculum examination and assess the size and contour and tenderness of the uterus. And the last one for rectal examination to exclude any colorectal problem. So the aim of the examination, bare vaginal examination to determine the bleeding site, any suspicious lesion, and assess the size and any tenderness of the uterus. And the last one for rectal examination to exclude any rectal problem. After that, do cervical smear or pap smear to exclude any cervical pathology. Then approach to the investigation. General investigation, and general investigation and local investigation. So the diagnosis, first one by history, then by examination. Examination, either general examination and abdominal or pelvic examination. Investigation, general investigation by complete blood count, coagulation screening, liver function test, renal function test, and chest X-ray, and chest imaging. Specific investigation. Specific investigation by endometrial sampling. Endometrial sampling can do either in outpatient biopsy, which is doing by multiple methods like vapor aspiration, pipal sampling, and hysteroscopic and directed endometrial biopsy. This is outpatient endometrial sampling. Or inpatient endometrial sampling, either first one by dilatation and curettage. These usually need anesthesia. Or by dilatation and diffraction curettage. And the last one by hysteroscopy and curettage. The most sensitive one by hysteroscopy and endometrial biopsy because it is detected 100% endometrial carcinoma. So the specific investigation, first one by endometrial sampling, either in outpatient or inpatient. Outpatient by vapor aspiration or by pipal aspiration or by hysteroscopic and endometrial sampling. Inpatient endometrial sampling either by dilatation and curettage or dilatation and diffraction curettage or by hysteroscopy and curettage. Second specific investigation, transvaginal ultrasound for endometrial thickness, transvaginal which may play a role in screening for uterine malignancy in women with post-menopausal bleeding. Any endometrial thickness exceeding 4 to 5 mm on ultrasound should be suggestive for endometrial pathology. But ultrasound cannot be used to replace endometrial biopsy as a mean to exclude endometrial cancer. May investigated by saline sonohysterogram, and infusion of normal saline in the uterine cavity. This is a diagram for post-menopausal bleeding and transvaginal ultrasound. The third specific investigation, magnetic resonance imaging by MRI. It is used to evaluation of endometrial thickness and to predict any myometrial invasion in patients who are suspected to having carcinoma. If any suspicion of endometrial carcinoma or endometrial hyperplasia should be investigated by pelvic MRI to exclude any distant metastasis and to detect any myometrial invasion. Approach to post-menopausal treatment. Treatment first one by general measures, correction of general condition, by hospitalization, by assessment of the blood loss, treatment of life-threatening bleeding, by blood transfusion, correction of anemia, correction of infection, vital parameters to find out the size and source of the bleeding. The first one by general measures. Definitive treatment usually depending on the cause. So, depending on the cause, the definitive treatment depending on the cause. Atrophic vaginitis usually treated by local estrogen. Endometrial hyperplasia usually depending on the type of endometrial hyperplasia. And endometrial carcinoma usually treated by surgery and may be needed to the adjuvant therapy. Thank you.